Another portion of the deep back muscles involves the sacrospinalis group, more commonly known as the Erector Spinae group. It has three main muscle bunches: the Iliocostalis, the Longissimus, and the Spinalis. You can remember this with the fun mnemonic, I like spaghetti. I for Iliocostalis, L for like, and S for Spinalis, and it works its way laterally towards medially. So the Iliocostalis muscles will be the most lateral, the Longissimus muscles will be in the middle, and then the Spinalis muscles will be most medial. So for these three groups of Erector Spinae muscles, there's four subcategories of muscles. There's the capitus, the cervicis, thoracis, and lumborum. These will help you because the name of them normally reveals where the muscle is inserting. So all the capitus muscles will be inserting somewhere on the skull or the cap. Cervicis muscles will insert somewhere on the cervical vertebra. Same with thoracis on the thoracic vertebra. And lumborum for the lumbar vertebra. So for Iliocostalis, it consists of cervicis, thoracis, and lumborum. The other two groups, the Longissimus and the Spinalis, do not have a lumborum section, but they do have capitus. So each Longissimus and Spinalis will have a capitus and a cervicis, and each of them will also have a thoracis. Now each of these will have its own origin and insertion, which we'll go over later in this video, but the majority of all of these will be innervated by dorsal rami of some level of spinal nerves. So it's easy to remember that all the innervation for these muscles will be by the dorsal rami. Another simple fact is that all the blood supply will be provided by the posterior branches of the posterior intercostal arteries. So now we'll dig into the specifics of Iliocostalis cervicis, Iliocostalis thoracis, Iliocostalis lumborum, Longissimus capitus, Longissimus cervicis, Longissimus thoracis, and finally the Spinalis capitus, Spinalis cervicis, and Spinalis thoracis to complete the Erector Spinae group. The most lateral section of muscles in the Erector Spinae group is the Iliocostalis cervicis, thoracis, and lumborum. There is no Iliocostalis capitus. So we'll start with Iliocostalis cervicis that originates on ribs 3 through 6 and will insert on the transverse process of C4 through 6. It is innervated by the dorsal rami of the lower cervical nerves, and its action is ipsilateral side bending of the spine and spine extension. So here's our Iliocostalis cervicis. It will perform ipsilateral side bending of the spine as well as spine extension. So the next group is Iliocostalis thoracis. The Iliocostalis thoracis originate on ribs 7 through 12, so the lower half of the ribs, and it will come up to insert on the first half of the ribs, ribs 1 through 6. It is innervated by the dorsal rami of the thoracic spinal nerves, and its action is the same as Iliocostalis cervicis, with ipsilateral side bending of the spine and bilateral spine extension. The last in this grouping is Iliocostalis lumborum. The Iliocostalis lumborum will originate on the spinous process of T11 through L5. It will also originate from the sacral crest and the iliac crest. It will go over to insert on the lower 6th rib. It is innervated by the dorsal rami of the lumbar spinal nerves, and it has the same action as the rest of the muscles with ipsilateral side bending of the spine and spine extension. Now notice the similarities we have here. For innervation, the cervical spinal nerves innervate the iliocostalis cervicis. The thoracic spinal nerves innervate the iliocostalis thoracis. And the lumbar spinal nerves innervate the iliocostalis lumborum. Another thing is that it goes from ribs to ribs to ribs of cervicis, thoracis, and lumborum. The origin of the thoracis is the insertion of the iliocostalis lumborum, and the insertion of iliocostalis thoracis is essentially the same origin of the iliocostalis cervicis. So it travels the most laterally out of the erector spinal group and goes from your iliac crest across the ribs and up to the cervical transverse processes. The longissimus group consists of a capitus, a longissimus cervicis, and a longissimus thoracis. There's no longissimus lumborum. So we'll start with the longissimus capitus that originates on the transverse process of T1 through 5 and the articular process of C4 through 7, and it will travel superiorly to insert on the mastoid process. It is innervated by the dorsal rami of the lower cervical nerves, and its action is ipsilateral rotation of the head and bilateral extension. So if this is the side we're looking at, ipsilateral rotation and bilateral head extension. The longissimus cervicis originates at the transverse process of T1 through 5. Notice how this is the same as the longissimus capitus origin part of it, the transverse process of T1 through 5. And it'll go up to insert on the transverse process of C2 through 6. It is innervated by the dorsal rami of the cervical and thoracic spinal nerves, and its action is ipsilateral side bending of the head and spine extension. So on our longissimus cervicis here, ipsilateral side bend of the head and bilateral extension. Lastly, we have longissimus thoracis. Longissimus thoracis originates on the spinous process of L1 through 5, the dorsal surface of the sacrum, the iliac crest, and the thoracolumbar fascia. The longissimus thoracis will insert on all of the thoracic and all of the lumbar transverse processes, as well as ribs 2 through 12. So essentially all the ribs except for the first one. It is innervated by the dorsal rami of the lumbar and thoracic nerves. Its action is ipsilateral side bending of the spine and bilateral spine extension. So ipsilateral side bend of the spine and spine bilateral extension. The spinalis group consists of a spinalis capitus, spinalis cervicis, and a spinalis thoracis. There is no spinalis lumborum. We're going to start with the spinalis capitus. So the origin and insertion for spinalis capitus is kind of blurry because it blends with the semispinalis capitus, which we'll get to later. But for now, we'll just know that it's on transverse process C7 through 6 through T6, and it will insert in between the nuchal lines on the skull. The innervation of spinalis capitus is from the dorsal rami of the lower cervical nerves, and its action is spine extension. The spinalis cervicis will originate on spinous process of C7 and insert on the spinous process of C2. It is innervated by the dorsal rami of the cervical and thoracic nerves, and its action is the same with spine extension. Lastly, we have spinalis thoracis. Spinalis thoracis originates on the spinous processes of T11 through L2. T11 through L2. And will travel to insert on the spinous process of T1 through 4. It is innervated by the dorsal rami of the thoracic and lumbar spinal nerves, and its action, you guessed it, is the same as the rest of this group with spine extension.